Good evening, everyone. How are you guys?
All right.
Good. We played a couple testimonials just so you can see what other people are saying about stem cell therapy, and I'll give you my story, and then we'll share a few others with you as well. So I am a chiropractor by training, and I'm also a wellness practitioner. So a lot of people want to know, why is a chiropractor speaking about stem cells? I don't perform the stem cell therapy. We are a medical office, and we have medical providers here. Our medical providers perform the stem cell therapy. I am an owner of the clinic, but I'm also somebody who's in the same place that many of you are. So about 4 years ago, I had an injury to my shoulder that prevented me from doing almost everything. And I'll go into a little more detail about what happened there, but I didn't have answers for my pain. I didn't know what I was going to do, so I was in the same place that many people are here. How many people have like a knee or a shoulder or back issue? Is that what most people have? I've always had empathy for people that were injured. That's why I became a chiropractor, but until it happened to me, like until it happens to you, it changes it, right? So what happened to me was, I was going on spring break with my daughter. She was 6 at the time, and she was walking down the stairs in front of me. I was behind her. I had a backpack on, and I had my hand at the suitcase at the top of the stairs. And she started to slip, so I reached out and grabbed her. And as she fell forward, I went down the stairs, but my arm on top of my suitcase was stuck, and it hyperextended, rotated, and I heard my shoulder tear. And it was that tear sound where you're like, oh no. I am very active. I wakeboard, I wake surf, I do kind of extreme sports stuff. And I've sprained and injured a joint before. I've, torn a muscle. This was different right away. It was deep burn. Couldn't get my hand above my ear for 2.5 weeks. I couldn't work out for months. And when I could work out, I couldn't use weight. I don't want to say I'm prideful, but I used to be able to put some weight on the machine, right? And then I had like 10 pounds and I could barely do it. It was just, I could not do that motion. I was still adjusting at that time. And every time I would adjust, it would send pain shooting up my arm. And the pain started getting so bad, for 8 months I couldn't sleep on my left side. And when I was sleeping on my back to roll to my right, I had to grab my arm, hold it, and roll over because it hurt so bad. I had never had a cortisone shot in my body, ever, up till that point. I did 3 shots in my shoulder in our clinics, and it didn't touch the pain. It didn't do anything for it. I did at least 5 lidocaine shots just to try to get some of the pain to go away. Wouldn't go away. So for 8 months, I had pain radiating down my arm. It was going up into my neck and shoulder. I couldn't work out. I was still trying to adjust, and I didn't know what else to do. So I was thinking, am I going to have surgery? Because if I have to have surgery, how am I going to work? And we have clinics all across the country. That's my main job. I don't practice anymore. I'm the CEO of a company that puts and trains regenerative medicine providers into clinics. So we have 50 clinics across the country, and we have over 60 medical doctors and nurse practitioners that work for us. And we train them on regenerative medicine. And the reason we got into it is because I had an injury that wasn't healing. And fortunately, one of our clinics that we work with at the time said, have you tried stem cells? And we didn't know anything about stem cells. So that led us to what many of you are doing. What are stem cells? Can it help me? How do they work? So me, along with our medical advisors and our scientific advisors, we started talking to all the laboratories and all the different stem cell providers. What kind of stem cells do you use? How do they work? What are the long-term outcomes? And we spent 4 months looking at all the different stem cells that are available. And we decided on using cord blood stem cells and Wharton's jelly stem cells, which all come from the umbilical cord. And we'll explain why we did that tonight. But first, I want to let you know, no babies are harmed with these stem cells. That is completely illegal in the U.S., and it should be. This is cord blood from healthy babies that are born to healthy mothers, and it's donated. So there's no harm to any living being with this. So I guinea pigged it. I have a saying that you should eat your own dog food, which is when I tell people to stretch, I stretch. When I tell people to work out, I work out. When I tell them to eat better, I eat better. So we looked at stem cells and we decided, yeah, we're going to do it. We want to use umbilical. I had an injection done on my shoulder, and I had an injection done on my right knee because in 1995, when I was still in high school, that's a while ago though, it's like almost 30 years now, I think, I injured my knee skiing. So bad that I had to walk down the mountain because I couldn't ski anymore. And it always hurt. I would wear a knee brace when I wakeboarded. I would wear a knee brace when I was going up and down stairs. I'd wear a knee brace when I drove a long time because it just ached. And so I had my knee treated as well. And 12 weeks after I had my stem cell therapy, I thought my shoulder was 100%. No pain. I was back to lifting. I was back to adjusting. But 2 weeks after that, that's where I got 100%. And I have not had a problem with my shoulder since. I'm back to lifting. I'm back to wakeboarding. I do everything I want to do. And sometimes I take for granted how bad it hurt because it doesn't even bother me anymore. I don't even think about it. And neither does my knee. So that's how we started using stem cells, because we had patients all across the country in our practices that weren't getting better with what we were offering them, which at that point we did steroid shots and we did physical therapy and we did chiropractic, but still some people weren't getting better. So we said, let's start trying it on more people that aren't getting better and see if they get better. And people kept getting better. And that's how we started with stem cell therapy across all of our practices. And since then, in the last 18 months, we've done over 11,000 stem cell therapies. And the success rate is high. It's like 80%, which is really, really good. So a couple other stories. This was from a colleague of mine. He wanted to be able to run marathons. He's in his 60s. So he came in and we did stem cell therapy on his knee. And he just sent me this text one day. It's like, started running again and forgot that he hurt because he didn't have any pain. This one is actually from my dad. He is 72, pretty fit guy, always active. And he and my mom were going on an Alaska cruise. My mom was a school teacher. My dad worked at a college, so both educators, and they retired and they want to have fun. He was wearing 2 copper fit knee braces and then one on his ankle. And when he would walk, you could tell his legs were kind of weak and they wanted to give out. He was going up and down stairs, they were weak. So I said, Dad, let's try the stem cells on you. It works really, really well. He sent me this text when they were in Alaska. Doing a lot of walking and stepping. My knee and ankle has not, and he's not Irish, so it should say my knee and ankle has been pain-free with no brace. So this is something that we use in our friends and family too. I've treated many, many friends. I've recommended it to people all across the country. I think it's the best first option because many people are looking for something that's going to help them get better, something natural, something that's regenerative, something that isn't traditional medicine. And this could be the answer for a lot of you. So that's what we're here to do tonight, is just educate you and tell you a little bit about the options of stem cell therapy. We're going to cover the cost. We're going to cover the different types of therapy, all of those things so that you can make a good decision, because that's what you have to do, is figure out if stem cell therapy is right for you. But we also treat dogs, right? Everybody loves dogs. I hope so. You know what's unique about animals, especially dogs? They don't have a placebo effect. They can't tell you they feel better when they don't. It's through lab results. It's through their activity. So stem cells, we actually have veterinarians that treat dogs with stem cells, the same stem cells from the umbilical cord of humans. They can be used in dogs. This dog is 14 years old, and after it got treated, it started running around. This dog decreased its pain medication. They're seeing old dogs become youthful again. This dog is Ivan. He looks old and tired. He's like 15 years old here. He just got treated with an IV infusion. He started running to greet his mom again. He started gaining weight back from being sick. He started jumping back into his car because they suffer from the same thing we do. They get bad hips, they get bad knees, they lose weight. The reason stem cell therapy works is because every living thing is regenerating all the time. And that used to be a belief. People used to say, do you believe your body's always healing? Do you believe your body's always regenerating? Well, science has proven that now. The cells that you were born with when you came out of your mother's womb are not the same cells that your body's made up of today. They're replacing themselves all the time. You take a plant out of sunlight and stop watering it, what happens? It starts to die. It starts to not regenerate. You put it in sunlight and give it water, what happens? It starts to regenerate. So this is what science has proven. Your stomach cells, because of the acid in them, regenerate about every 5 days. Your skin cells, your epidermis, is about every 2 weeks. That's why if you go on vacation, you come back, you start losing your tan, because those skin cells fall off and new ones replace them. Your red blood cells replace every 4 months. Your liver is about every 5 months. And your skeletal system, which is what most of us have an issue with, is about every 10 years. So your body's always regenerating, but different things regenerate at different rates. And that's important to understand when you're looking at regenerative medicine and stem cells, because they work with the body's ability to regenerate. And some of those things regenerate at different speeds. So modern medicine, this is what most of us have tried. Epidurals, cortisone shots, pain medications, those aren't designed to fix anything, are they? But it's not the doctors that are against these things. That's the tools they had, right? Those are the tools that were available. Now it's starting to change. So regenerative medicine is completely different. It's not how can we block a pain signal so you don't feel it. It's what can we do to your body to help it regenerate and heal so that area truly starts to function and be pain-free. That is what we're going to talk about today. So regenerative medicine is physiology, how your body works, how can you support it, how does it grow and repair. We're going to talk about mesenchymal cells a lot today. The reason is because these types of stem cells are really good for musculoskeletal problems, knees, shoulders, back, joint, muscle injuries. But there's two words I want you guys to think about today. Quantity and quality. Quantity is how many, and quality is how good are they. This is a chart of your mesenchymal stem cells as you age. When you're born, 1 in 10,000 cells is a mesenchymal stem cell in your body. By the time you're in your mid-teenager years, 13, 1 in 100,000 is a mesenchymal stem cell. By the time you're in your 30s, it's 1 in 250,000. By the time you're in your 40s, it's 1 in 400,000. And by the time you're 80, it's 1 in 2 million. So you can see your mesenchymal stem cells really drop as you age, right? What happens from birth to teenager at a more rapid rate than it's ever going to happen in your life again? You're going from about 1 foot to 5 feet to 6 feet in that time frame. So your body's regenerating and healing and growing very fast. So it makes sense you'd have more stem cells, right? This is where most of us start to have pain and problems. When I was young, and I grew up in the early 90s where we still rode bikes and we didn't have cell phones, we would ride miles to a friend's house, play tackle football with no pads on, sleep on the floor, get up the next day and go swimming and not hurt at all. And now, when we're 40, 50, 60, we can pull the weed and our back hurts for a week. Right? There's an injury there, it doesn't heal as fast. So when you're thinking about the source of your stem cells, where you're going to get them, does it make more sense to get them when 1 in a million is a mesenchymal stem cell, which is the stem cells that we need to heal? Or does it make sense to get it when it's 1 in 10,000? Which one would you rather have?
1 in 10,000.
1 in 10,000. So mesenchymal stem cell, why is it so special and what is it? It's a multipotent type of stem cell. It's from the mesoderm, which means it's from the connective tissue line. And that stem cell has to be able to do certain things to become or be labeled a mesenchymal stem cell. It has to self-replicate, which they all do. They actually replicate every 24 to 28 hours. They're making a new one. It has to be able to differentiate and stimulate cartilage, tendons, and ligaments, connective tissue to heal. Fat has to be able to stimulate bone. Muscle repair, it has to fight apoptosis, which is cell death. That's why they work really well in anti-inflammatory autoimmune issues, and they're doing a lot of research on that. And they have to fight inflammation. Stem cells are drawn to inflammation. That's how the body tells the signals and the healing capacity of your body that place is injured. And you don't have to think about it. My daughter, who you'll hear me mention her again, broke her collarbone 2 years ago. And she was in a sling and it took a while to heal. But as that bone was healing, did she have to not go to school and just think all day about body heal that bone, body heal that bone? Or does the body innately heal? It innately heals. And she healed quick because she had a lot of stem cells. So the body knows innately how and what it needs to heal. And it sends out the chemicals it needs for those stem cells to be drawn in. One of my good friends, Dr. Ryan Bentley, I've known him since elementary school. He's an MD, he's a PhD, and he's a chiropractor. We call him Triple Doc. because one wasn't enough, so he's 3. He was just published in the British Medical Journal on type 2 diabetes and the ketogenic diet. Very smart guy. He likes to dumb down a mesenchymal cell and relate it to like the Army Corps of Engineers. There was just that hurricane in Mexico Beach, Florida, right? You saw the pictures, the roads were destroyed, the electric infrastructure was down, they didn't have water, they didn't have anything. The Army Corps of Engineers goes in and they organize. You're going to fix the roads. You're going to fix the power. You're going to go rescue people. You're going to make sure food is delivered. It takes chaos. It organizes it so order and regeneration and restoration can happen. That's what a mesenchymal stem cell does. It goes in and all the areas that are injured, it tells them and stimulates those areas how to heal. That's why it's such a special type of stem cell. It is also immune privileged, which is a very important point. When somebody gets an organ donor, or they have an organ donated to them, they have to be on drugs to suppress their immune system so they don't reject it, right? A lot of times. There's a little fingerprint on your cells that tell your body, is that cell part of me or is it not part of me? And if it has the signal that it's not part of you, your body tries to reject it. These mesenchymal stem cells from the cord blood and the Wharton's jelly are so immature and they're immune privileged, they don't have what's called an HLA marker, which is like the fingerprint that tells your body that it's foreign. So their body doesn't reject them, and they can be used in almost anybody. There's no tissue matching needed with these cells. That's what's so unique about these cells as well. I call this the good, the neutral, and the ugly. Because if you Google stem cells, you'll see people that think it's the greatest thing on earth. You'll see people that say, I don't know, there needs to be more research, it's too early. And you'll see people that say, anybody who's trying to talk to you about stem cells is a charlatan and they're selling snake oil, you should run, right? Here's what you should do. You should look it up for yourself. If you go to clinicaltrials.gov and you type in stem cells in blank, it'll show you any clinical trial that's going on, that's been completed or is currently active, and what those results are. Stem cell therapy has been used around the world and it's gaining popularity. So I think the acceptance of stem cells isn't, does it work anymore? It is, yeah, it works, but what else can it do? But this is a good resource for you guys to look it up on your own. A lot of the research you'll see on this is related to chronic pain. Low back pain, neck pain, knee pain, ankles, because those mesenchymal stem cells work so well in repairing those types of injuries and damage. But you also see all types of other conditions, autoimmune conditions, neurological conditions, type 1 diabetic conditions. Anytime there's an injury in the body has to heal, right? Stem cells are involved in that healing process. That's why you see them studying virtually every condition that can go wrong with the body, because in that healing reparative cycle, a stem cell is involved. So here is the sources of stem cells, typically in the US, that you will be looking at. And these are what we looked at when we were deciding which type of stem cells to offer. You have your umbilical cord blood, the umbilical cord Wharton's jelly, which is a tissue from the umbilical cord. You have your own, which is called autologous, where they go into your bone, they pull out some bone marrow, they spin it down, and then they inject those cells back in, and you can take it out of your fat. Those are places they have mesenchymal cells. All of these work. We just found that the cord blood and the Wharton's jelly worked better. And it gets back to those two words. Remember them? Quantity and quality. By the time somebody's using their own bone marrow for stem cells, they're probably 50, 60, 70 years old. And if you remember that, your stem cell count is about 1 in a million or 1 in 2 million. The cord blood is the most viable, immune-privileged source of stem cells available at this time. That's why we chose it. The other issue that you look at with these is, how do you know how many cells you're getting? The umbilical cord blood and the umbilical cord jelly, they count exactly how many cells, stem cells are in there before they package it. When you're using your own, from your fat or from your bone, you know there's some in there, but you don't know how many. So the quantity is not calculable, and the quality is less. Not that they don't work, it's just we found they didn't work as well. I'm not going to bore you with research, but this is some of the stuff they're showing. If you're 18 to 19 years old, using your own stem cells out of your own body is a good option for you because you have a good quality and quantity of stem cells in your body. If you're over that age, it's probably not the best option for you. The umbilical cord blood offers advantages over the bone marrow because it doesn't require that HLA matching. That's that fingerprint. It has less incidence of graft host, so it's not rejected, and it can be used allogenically, which means it can be given from one person to another. And this is super important. It can be banked. It can be cryo-frozen. So there's no need to go in for a surgical procedure to get stem cells anymore. They can be cryo-frozen, shipped, and utilized. So it's very effective and it's very non-invasive. One more study. I got to show a couple studies. That's my nerd part of me. So degenerative diseases are a major public health concern. No surprise there, right? Knees, shoulders. What they found are those mesenchymal stem cells have a great potential for treating those diseases. But surprise, what do we talk about? Quantity and quality of mesenchymal stem cells decline with age, limiting the effectiveness of autologous stem cells for treating the elderly. Basically, that means if you're old and use your own stem cells, not the best option. So all of this stuff is what we looked at, and it pointed us back to cord blood and Wharton's jelly. This is some of the research that we found and we looked at to make our decision. Standards for the stem cells. There are certain regulations and standards now that people are going towards and labs are going to make sure that you're getting a very high quality product. All of the stem cells that we use follow the International Society of Cellular Therapy standards, which basically means it's got to have this in it, and it's got to have this much in it, and the cells have to be able to do this to be a mesenchymal cell. So it's just like a regulatory thing to make sure the products are good. The collection donation part is another question. We talked about the fetuses are not harmed, healthy babies, healthy mothers. But how this process works is a mother donates their cord blood after birth. Healthy baby, full-term birth. The mother and the father are both screened. They both undergo blood testing. The umbilical cord is donated to a laboratory. It's shipped within 48 hours and it's processed using aseptic FDA guideline techniques. From there, they isolate either cord blood or they isolate the Wharton's jelly to make their stem cell product. Then they cryo-freeze it. These stem cells can stay cryo-frozen for years and years and years on end. Then they take a batch and they take it to a third-party laboratory for testing. Just like blood you would get from the hospital, undergoes testing. So does this. It undergoes all the disease testing, serology testing, and once it's cleared, that lot can be used for stem cell therapy. You order, they overnight ship it on dry ice, and it's used within 48 hours unless you have a cryo-freezer. So the delivery of it is very safe and very effective and very non-invasive. A couple questions we're going to go over. These are the most common that we get. The first is stem cell therapy FDA approved? Stem cell therapy is a natural, still considered experimental treatment. The FDA doesn't approve stem cells. What it does is it regulates the laboratories that produce stem cells, and it regulates what can be done for it to be considered a stem cell. So all the laboratories have to go through these FDA guidelines. Is it safe? The umbilical cord blood and the Wharton's jelly are extremely safe, primarily because of all the disease testing it goes through, and second, it doesn't have those HLA antigen markers on it. Where does the HUC cells come from? We talked about they come from healthy babies, full term, from the cord blood that's donated, or from the Wharton's jelly, which is the tissue in the umbilical cord. Are the cells viable? All the cells come with a report on the flow cytometry, which is how they count and verify how many cells are in each dose. So each batch you get, you know exactly how many mesenchymal cells are in each one of those CCs, which is a CC is typically what is used to treat one joint. How long will results last? One thing about stem cells is they do not reverse the aging process. So when you put them in your body, and I say this jokingly, but I'm serious about it too, you're not going to reverse 40 years of your life. You're not going to float out with angel wings, right? But is that area of that body going to regenerate and heal? Yes, it is. So how long will treatments last? Treatments should be a one and done treatment unless you're really, really severe. I don't ever intend to have my shoulder treated again. If I fall and have an injury and damage it, maybe I will. Can you benefit if you're bone on bone? We hear this a lot, but bone on bone is a generic term that's used quite a bit. There's phase 1, 2, 3, and 4 degeneration of a joint. And typically, what you have to figure out is what phase you're in. Somebody may have labeled you bone on bone, and you're really not. If you're bone on bone, you typically cannot move a joint. So those are why we want to see X-ray reports or MRIs to see if you would be a candidate based on the imaging. What is the cost of stem cells? Stem cell therapy, depending on how many regions you're going to have treated. When I say regions, if it's one knee and one shoulder or just one knee, typically one region is 1 cc, and 1 cc of stem cells costs about $4,000. So treatment ranges between $4,000 to $8,000. That's where the treatment ranges is. Is it covered by insurance? It is not. Stem cell therapy is not covered by insurance. There isn't a code for the umbilical cord or wart jelly tissue, so it is a cash service. Are there any side effects? The side effects can be soreness at an injection site. Some people get flu-like symptoms a day or two after. That's really about it. It's a very safe product to use. How many treatments are needed? Typically just one. In severe cases, you may need a booster at 6 months or a year. But that's where you kind of got to evaluate your specific condition and what the recommendations might be. How is success determined? This is determined on realistic goals too. My dad's 72. He wanted to be able to walk without pain, not wear his braces. Those were his goals. Those are achievable. If he said, I want to be able to dunk a basketball, I would have said, Daddy, we got to reevaluate your goals, right? So part of it is where you really want to get, and is that obtainable? And why should you not consider stem cell therapy? The two biggest reasons, obviously, are the cost. We realize that's not an insignificant amount of money. It's not covered by insurance, and it's not 100% guaranteed. The results are about 80%. 80% of people achieve really, really, really good results. So you have to be okay with, what if I only get 30% or 40 or 50? Those are the two main reasons. The cost, we do have financing for them. That is an option. And then also the goals, what your recommendations are. We have to make sure you're good. You have a realistic goal of where you really want to get. So the main questions people come here with are, do I have a problem? Most of us already know, or most of you here know you do, right? It's a knee, it's a shoulder, it's a back. And then it's, can you help me? Stem cell therapy is a very, very viable option for you. We've seen it work in thousands and thousands of people, and the success rate is extremely high. We covered the cost. That's usually what people want to know. The other part, how much does it cost? Between $4,000 to $8,000, depending on how many joints are being treated. And will it help me? I can tell you it is the first thing I would recommend to anybody that's a friend or family member of mine and I have. And they have done the same for theirs. I was sitting where most of you guys are, and if it didn't work on me, I wouldn't be recommending it. If it didn't work on my father, I wouldn't be recommending it. If it didn't work on my friends and my patients, I wouldn't be recommending it. So it is an option that you should highly, highly consider. One of the things we want to let you guys have is the opportunity to ask specific questions about your cases if you'd like. There's something called HIPAA, which is you can't talk about somebody else's case in front of other people. So the option that we'd like to give people is, depending on where you live, you can have a phone consultation with us for free. We'll look at reports. We'll determine if you could be a candidate, or if you want to come in and visit us in the office, you can do that too. That's free of charge. That is simply to say, for you to say, here's what I got going on. What do you think my chances of getting better are? This is what I want to have done. And then obviously cost options can be discussed there. We don't want cost to be a barrier for you guys to see if it's an option for you. And so we have consults. We won't answer a ton of questions tonight. I will stay around for a little bit. If you guys just want to come up to me individually, have something you want to ask me, I'm happy to do that. But if it's really in depth and we need to look at reports and all that, I'd advise you to take advantage of either the call or the free consultation to see if it's right for you. So hopefully this was helpful. Hopefully it kind of digested what stem cell therapy is, what your options are, and some of the other resources you could look at as well. So thank you guys for coming, and